And welcome to Boom Goddess Radio. I'm Jennifer Davis Page, your host, and today we're going to be discussing summer and your hearing. And we have an expert audiologist with us today, Dr. Cristi Moore, the owner of Sonora Hearing Care. Welcome, Dr. Cristi. Thank you so much.
Thank you. Thank you for having me.
You're very welcome. Today we have some Boom Goddess listeners that had some questions they wanted to ask you. So you've got a panel of women that have some really good questions for you. So
awesome.
I'm going to introduce them. Darrell Bakeman.
Hello, Dr. Cristi.
Hello.
And we've got Maria Ramirez Turillo. Am I pronouncing your name correctly, Turillo?
Yes, Trio.
I apologize. And Susan Allen. And we welcome all of you and thank you for joining Dr. Cristi and I. Dr. Cristi, let's start from the very top. Let's tell our listeners how you were encouraged to go into the audiology business.
Great. That's a question I get asked frequently. And I will say that in college, I actually started out as a music major. That was what I was going to do. I had played flute for many, many years prior to college and decided that's what I wanted to do. So I went to school on a scholarship actually for being a music major. And as I got into those courses, I enjoyed it very much, but I decided that I didn't think I wanted to actually play an instrument professionally. So I started looking at different areas of a career. And I always liked the health fields. And I started looking at psychology and I looked at some other healthcare disciplines. And the discipline of speech pathology really was interesting to me and the hearing aspects of it. So I took a course, introductory course on hearing and speech science. And I really liked it. I liked the hearing aspect of it. So after I took that course, I decided I would change my major over to audiology. Because of the background I had with music, there's a lot of acoustics, a lot of physics that are in audiology. So I had a very good background with that. I was very familiar with sound and how the ear worked and things as far as that goes. I had a grandparent that was hard of hearing for most of her adult life. So I grew up knowing and understanding what hearing loss was and what hearing aids were. So I had a foundation already. So it just seemed like a really good career to kind of fall into. And that's really how I got started in the field of audiology.
Well, tell me, what brought you to the Southwest?
Yes, I grew up in Idaho. So I was born in the Northwest part of the country and went to school there and did my graduate studies in Utah. And then after I graduated, I needed to find a job. And when I was younger, my family had lived in Arizona for a few years and I loved the weather. And I thought it would be great. I was not a skier. I was not a snow lover. So moving to Arizona seemed like a logical thing to do. There were jobs available in Arizona, in Tucson. I had a friend that lived in Tucson, so I decided that that would be a great opportunity for me to kind of pick up my life, move down, start brand new. And I started working immediately in a clinic and just made friends and just had a wonderful time. And I have been here ever since, and it's going on 21 years now.
This is a wonderful place to meet people.
Definitely.
And you came down here and had a job, and you were really ready to hit the ground running, which is really wonderful. Tell us how and when you started Sonora Hearing Care.
Oh, okay, yes. So when I first came down, I worked for a corporate audiology and hearing care practice. So they were a chain of offices and had several offices here in Tucson and Phoenix, New Mexico, California, et cetera. So I came in to work for that company. I figured that was a great opportunity for me to learn the business, but also finish my externship that I was required to do for part of my certification. So I was mentored by some great audiologists that were already licensed. And through that, I learned the business of working in kind of a private practice type aspect. And I loved working with patients that had hearing loss, had hearing aids, assistive devices. And I did that for about 3 years. And then I actually looked at another opportunity. A manufacturer approached me and said, we need a trainer that can go around and start talking to clinics about our products. And we'd like to know if you might be interested. You can be based in Tucson. And that's great because at the time I had just started dating my husband. so I didn't want to move at that point. But I did that job for about a year. I traveled around the country. I planned a wedding during that time. And then right before we got married, I left that job and got back into working for another dispenser in Casa Grande and worked for her for about 3 years. And then an opportunity came where the owner of the Sonora Hearing Care was looking for an exit strategy. So she was looking for a partner. So I came and started working with her as a partner. And then we worked together for about 4 years. And in 2010, I purchased the practice from her and took it over fully 100% and have grown it, bought another practice, grew that into our existing practice. And we now have a beautiful building and a new location, and we're just going strong. We're growing all the time.
That's wonderful. That's wonderful. I just have a little really fun story to tell you. I believe, I was looking at your Facebook page, and I believe you and I were married on the same day, same year.
We were. We actually were, because I think I commented on that one time when you had celebrated your anniversary, and I said, yeah, that's my anniversary too.
Now, ladies, I'd like you to ask Dr. Cristi your questions. And Darrell, would you like to start today?
Sure, I can start.
Thank
Dr.
you.
Cristi, I have a tube in my right ear because I had a lot of fluid that was accumulating. And rather than take antihistamines all the time, my ear doctor suggested that I get a tube put in. So I've had this tube for about 2 years, but I'm also a person that collects a lot of wax in her ear. So
Right.
sometimes the wax gets stuck on the tube, and that can be kind of hard to get off.
Oh,
And I'm
yeah.
curious, and it also affects my ability to hear in a
Yep.
room. I can't hear over noise. It's like,
Right.
if it's a lot going on, then I'm kind of like a deer with headlights. So I
Right.
find out about, could a hearing aid help me? And if so, what type of hearing aid?
Yeah, great question. So I guess a question I would ask is if you've had a hearing test done recently.
I've had hearing
And
done, yes.
okay. And if there is hearing loss present.
There's hearing loss present in the right ear.
Okay. So based on that fact, then depending on how much hearing loss there is and what type of hearing loss there is, then that could determine whether a hearing aid or hearing aids might be beneficial for you. So one of the things we would do is we'd want to see a current hearing test to find out what your hearing is. If that's not done recently, we would do that in the office to find out exactly how much hearing loss you have, what type of hearing loss you have, because that's important because that can determine how successful you might be with a hearing aid or hearing aid devices. And then from there, we can discuss what option or style might be the best for you based on what type of features you would like for those devices to do, whether you want them to connect up to a smartphone, whether you want them to, how well you want them to do in a noisy environment versus a quiet environment. So those are things that can better be answered looking at your individual hearing loss, doing otoscopy on your ear to find out exactly what the inside of your ear canal looks like. So to see if that is going to be an option for you. Absolutely.
So you're saying that there are different types of hearing aids for different hearing loss. This is the first time I didn't know that. That's an epiphany for me to know that.
Yeah. A lot of people think they are one size fits all, and they're not. We might use the same type of hearing aid, but we can customize it for many different hearing losses, many different ear anatomy, all that kind of thing. So there's lots and lots of options. It's not a one size fits all.
Wow, that's very insightful.
Yeah.
And the other question I have has to do with summertime, but we can get into that later. If somebody else might want to ask some questions.
Does the tube then have anything to do with would the tube stay in if she got a hearing aid, or would that be two things, or does the hearing aid replace the tube, or?
No, So the tube is it's inside the eardrum, obviously, or the tympanic membrane. And so it stays in there. Its function is to keep, provide an aeration, so air to circulate from the middle ear space into the outer ear space to keep that space equalized when the ear anatomy is no longer able to do it on its own. So what that means is that when you have a hearing aid is only going in a certain distance. It's nowhere near touching the eardrum or that tube. So those two can be in the same space just fine.
And while you were, I'll ask a question because it dovetails, Darrell. You were saying I have earwax issues as well. It's like, it sounds gross, but I mean, I got something out the size of a popcorn kernel the other day that just, anyway.
Right.
I've been meaning, Dr. Cristi, you have a machine, the irrigator?
Yeah, the irrigator.
So tell us about that. I think that's amazing.
Yeah, it's a special type of machine. Yeah, it's a special type of machine that uses water irrigation to flush out wax or debris that's in the ear canal. And it does it very safely because it uses water that is at body temperature. So it won't make you dizzy. We can control the amount of water that goes in so that it doesn't hurt. And that way it allows to gently remove and soften that earwax and gets it out within minutes. And so it's been very, very effective. It can be used on most people. However, it can't be used if you have a hole in your eardrum, because obviously we don't want to be shooting water into a space that normally would not have water. So if you have a tube or you've had a perforation or a hole in your eardrum, then that method we can't use. We have to use a different method.
Dr. Cristi, during COVID, I saw that you had drive-through service.
Yeah.
Can you tell us a little bit about whether your drive-through services and if you still have them?
Sure. So we implemented what was called curbside services. So what that would mean is that you could drive to our location, you would sit in your vehicle, you would call our number, we would check you in over the phone, go out to your vehicle, we could take your hearing aids and clean them, bring them back into our office, clean them, make sure that they were working well, or if you had needed a repair or any type of service that we could do remote like that. Once we had that completed, we would then bring that back out to the vehicle and send you on your way. So you could wait in the comfort of your vehicle. And we still do have that service available for patients that want to remain in their vehicle and not have necessarily come inside. So we're able to do a lot of things that we implemented during COVID that we thought we couldn't do. We were amazed that we can do hard things, and that was one of them.
And was that really very popular? We have just about 30 seconds left in this segment. Was that very popular?
Yes, it was. People really appreciated the fact that we were trying to keep people safe and yet still provide the services that they needed with their hearing aids. Absolutely.
Excellent. We are going to take a break and we will be right back. Please don't go away.
I'm Jenny Garth, and as a mother of 3, I know kids worry about a lot of things. Getting enough food to eat shouldn't be one of them. But here in America, that is a real worry for 1 in 5 children. This is unacceptable, and something Feeding America is working to solve. Through a nationwide network of food banks, Feeding America serves virtually every community in the United States, including yours. See how you can help your community. Visit feedingamerica.org. Together, we can solve hunger. Together, we're Feeding America.
Welcome back to Boom Goddess Radio. You're here with us today with Dr. Cristi Moore, a brilliant audiologist here in Tucson, Arizona. And she's got some guests with her today, Darrell, Maria, and Susan. And of course, I'm Jennifer Davis Page, your host of Boom Goddess Radio. Now, Susan, did you have any questions for Dr. Moore?
Yeah, the tinnitus thing and summer. Mine comes and goes, and I don't know if that's natural. It's the tinnitus is worse, it seems, when the barometric pressure is higher. Also is worse when I'm working out or when I bend over, I'll get tinnitus. What are the trigger things for it, and why is Is there anything you can do about that?
Yeah. So
Program your
tinnitus,
mind.
so tinnitus or tinnitus, as it's frequently called, is a symptom of something else. And it can be a symptom of hearing loss. It can be a symptom of something else going on in your body. It can be a result of inflammation. So that's one of the theories that we have. It's actually almost like a phantom sound that is not being generated in space. So it's not in our environment, but because of maybe something going on in the body, maybe the sound getting confused or the hair cells getting confused that are in the inner ear, they begin to generate a sound that isn't there. And then we perceive it as a ringing, a buzzing, a roaring that's in our ears. And that's how we perceive it. But in reality, it may actually be more of a function that's happening in our brain, in higher centers neurologically. So because of that, it can be affected by different things. So if you have barometric changes or weather changes, that can affect how your ears are equalizing pressure. And any type of pressure or inflammation can create that sound to be louder in the ear. So you might hear tinnitus that's a little louder during those times. If you're under stress, it can definitely affect it as well, because again, it's how our bodies cope or don't cope. So we can have different things that we then perceive with that. Some foods or drink can cause it too. Alcohol, caffeine, some types of teas or nuts can sometimes trigger it as well. So there are lots of things that it can be caused about. Obviously, some other health things can be related to it as well. That's why it's always good to visit with your primary care doctor to make sure everything in your health is in order. See an audiologist, have a hearing test, since it is something that's perceived in your ears. And then from there, we can discuss what it is, what may be causing it, and what can be done to help with it. So from an audiology standpoint, like what I do, I'm looking at it from strictly what can we do with sound management, whether we're using hearing aids if there's hearing loss, whether we're using other types of sound therapy, whether we're teaching you some relaxation techniques, whether we're trying to help you understand that it's not something that is there to react negatively, but we're going to help change your mindset. Sometimes cognitive behavioral therapy, working with a therapist can help with that too, as well as meditation and other things. So there's lots of therapies, lots of things that we can do, even if there's not specifically a cure to make it go away.
Mm-hmm.
We're talking about summer hearing, but can you tell me, I mean, we're down in the desert and it's this week has just been very, very hot. And
yeah, and humid.
So now, can you tell me how that affects, I mean, if you're a person that unfortunately works outside in the elements, you know, people that work for the city that are out all the time, will that affect their hearing working out in this heat?
It can. So again, it depends on what's going on. So when you're out in the heat, you're obviously going to be perspiring. So that can make the ear canals moist. If you've got earwax, that can make the wax more liquid, and it can build up more and create kind of a temporary hearing problem. It can cause, you know, more wetness in the ears, which can make it harder sometimes to hear and understand what's going on. You can get dust debris in the ear canals as well, with the winds blowing, or if you're working in dusty conditions, things like that. So yes, it definitely can do that. And then just being in the heat, just having the stress of that can definitely affect your perception of hearing as well.
Would it help those workers to put anything in their ears while they're working?
And for the noise as well, because if they're out working around construction, they're most likely going to also be around heavy equipment that's quite loud. So wearing hearing protection in that environment is really critical to protect their hearings from the loud sounds, as well as protect their ears from getting any dust or debris, things like that as well.
And what about the other person? Let's talk about the person in Chicago or Buffalo or Minneapolis in February. All right.
Yeah.
And they're also working outside, and now they're freezing. Okay. They're minus 15 and there's snow and ice everywhere. Does that affect your hearing?
Yes, that can affect your hearing as well, because again, you know, freezing temperatures are not good on the body in general. So skin is exposed to freezing temperatures that can cause, you know, frostbite and things like that to happen, swelling, all of that. So yeah, it can be the opposite as well.
Okay, well, thank you. Maria?
Yes, can I go back to a question regarding cleaning of ears? So I have
Yeah.
that I take care of. Both my parents are 90. So I wanted to ask you, how often should they get their ears cleaned? And do you know if Medicare covers cleanings like this?
Sure, absolutely. Okay. So the answer to your first question is really going to be dependent on how fast earwax builds up in a person's ear canal. So every person is different on how that happens. Some people build up earwax more often. It's something that our bodies do naturally because it's a cleaning aspect of our ears. It helps to keep our ears healthy in a sense because it keeps the pH balance in check. So we want a little bit of earwax. The problem is when it is produced faster than what our body can get rid of it. And sometimes when we get older, that process slows down or our skin is dry, so we build up more earwax. If you're wearing something in your ear all the time, like a hearing aid, then the wax can't move out of the ear naturally as well. So it kind of depends on how quickly a person is building up the earwax, but it may be once a year, twice a year, or every few months, they might have to have the earwax removed professionally to keep their ears free and clear from earwax. Now, as far as Medicare or insurance is covering that, in a physician's office, it may be covered. In an audiology office, it's often not. So we do charge privately for that in our office.
Perfect. Thank you.
We were talking about cost when we weren't on the air.
Right.
And we know that Medicare doesn't cover the cost of hearing aids, but
Right.
apparently there's some new opportunities that are being presented nationally that can possibly help us. Can you enlighten us about that?
Sure. So are you referring to the act that was recently signed by President Biden?
Yes,
Okay.
was that called the over-the-counter hearing aid program? Is that correct?
That is correct. Yes.
Okay.
So
Let's
that is
talk a little
some.
bit about that. That was interesting to me.
Yeah, absolutely. So that is something that's been in the work for several years. Actually, that was something that had been talked about during the Obama administration. And then when President Trump was in office, he actually signed that legislation to actually okay a class of hearing aids that could be sold over the counter without having to go to a hearing care professional. And then the FDA was to take that over and work with it and come up with that guideline. So the last 4 years, they haven't done much about it. And so what President Biden actually signed was to actually give them a time limit saying, okay, this is what we want to do. We want to have something in place in the next 120 days. The FDA was already planning on putting that into effect in September, which would be within that 120 days. So this is just basically signing something that they were planning on doing anyway, but now we have a date or a timeline in place. So what that's going to mean is that there's going to be a class of devices that can be called hearing aids, not just personal amplifiers. And they will be allowed to be sold over the counter. So you can go get them without a prescription, without a hearing test, without having to see an audiologist or a licensed hearing aid dispenser, and pick it for yourself. Take it home and see if it works. There may be some support. You may have like a phone call support, some computer support. You may have an app where you can adjust it. So there may be a few $100s to a couple $1,000s. We don't know yet with that because we don't know exactly what's going to be on the market. But it's got some pros and cons, just like anything that is self-fitting. If you are trying to fit a device for your hearing and you don't know what your hearing loss is, you don't have a prescription, it can be a little tricky to get a device to put in your ear and amplify sounds when you don't know how much hearing loss you have. So that's why it's very important, I think, for you to have a hearing test, because you need to know how much hearing loss you have. what degree you have, and whether something like that is going to be beneficial. Because it's not just about treating the ears, it's also about rehabilitating the brain to understand what those sounds mean. And putting a hearing aid on that is not prescription based may not give you all of the help that you need for your type of hearing loss or your ability to communicate.
Well, based on that, like right now, when we go to the drugstore, we buy cheaters, and we know exactly what magnitude we need.
Correct.
Now, is there going to be something? Do you know if there's going to be something like that? I mean, if, for example, no, you're shaking your head. No.
Yeah. At this point, it's really up in the air. We don't have a lot of those details. They've just said it's going to be for mild to moderate hearing loss. Well, that's a huge range, because a mild hearing loss can be a certain, amount of sound that you hear or don't hear. But there's a lot of difference between a moderate hearing loss, which, again, something that is over the counter may not have enough power to help you hear well in that situation. So if you aren't getting enough amplification or help, then you could actually be depriving yourself longer from getting the proper amount of hearing help that you need. And you may not actually be helping yourself than if you were to get something that was more prescription based. But again, it may be a good start for some people that do have just a little bit of hearing loss, maybe have a little bit of trouble hearing. It may be a good starter for them. But unfortunately, a majority of people that have more hearing loss may look to that strictly because of the cost, may not get the exact help that they need, if that makes sense.
We have just a couple of minutes left in this segment, but I'd like to tell our listeners that there's so much information that we want Dr. Cristi to give us. We're going to do a part 2. So this show will air, and then the following week we will air it, and you'll have the rest of the discussion. So, but we'll tell you about all of that as we close the show. One real quick question, the answer might have to be on next week's show, but can you have excellent hearing in one ear and bad hearing in another ear?
Yes, you certainly can. Yep, and that can be due to a number of things. From you can be born that way, or you can have an accident or have disease or an infection or something like that. Yeah, absolutely.
All right. Well, right now, all of us seem to have an earwax problem, and but we're going to talk about our earwax problem in next week's show. I'd like to thank Dr. Cristi. I'd like to thank Darrell and Susan and Maria for joining us on part 1 of Dr. Cristi's remarkable interview with Boom Goddess Radio. Please stay tuned to next week when we'll have part 2 of Dr. Cristi, and you'll get more information on your hearing. Thank you for joining us.